Hello and welcome to our presentation today, How to Get Holistic Care Covered by Insurance. I'm Melinda Giannini, the CEO of ABC Coding Solutions, and let's get started. Today we're going to discuss our mission, vision, and references so that you have a sense of the background of the company and what we've done. We want to talk about cash versus revenue coming from claims filed to insurance companies and even referrals from PPO networks. So when we develop an ideal work schedule for our clients, all of these things are taken into account and the provider is given the choices of how to structure their practice. We're going to talk to them about negatives versus positives billing. If you're our client, we really spend a lot of time thinking about how to make you happy. So from that position, we talk about the income that you want to make and then how many hours a week you want to work. We also go into the negatives, the pros and cons of billing insurance companies, because if you want to increase the number of patients you have, insurance is a good way to do it. Then we talk about the negatives and positives of doing that billing and how claims from that data, the claims that you file, support what you do. And underlying all of that, how our products and services support your billing. And then what we do when we work with practitioners and the recap of benefits to your practice. Then we're going to talk about how to get in touch with us. Our mission and vision since 1998 has centered around providing people with greater access to more care at less cost. And holistic care is definitely part of that because it's becoming more popular every year. And so everything that we have done is to help that happen. We have built a system to get non-physician and holistic care covered by insurance companies. And we did that based on my background of designing and monitoring insurance data for large employers for many years before I started this company. So I understood the internal workings of the insurance industry. Because of that, I've been able to help our company develop a path to identify cost-effective options to conventional medicine from the data that practitioners file to insurance companies. And this missing infrastructure is incredibly important if we want better care for more people at less cost. We have to know what that care is and how much it costs in order to change the patterns of care in this country. So we have supporters. Here's a few of them. These are thought leaders in the industry, and they have supported the development of ABC Code and praised the work that we have done. Importantly, advanced practice nurses that are a major part of our coding system. They've helped develop the codes that we have in the system, and they've helped establish the codes as viable within the nursing community. I've also worked with doctors who have created networks of alternative care practitioners and worked with insurance companies. And we helped Alaska Medicaid process over 2 million claims at a cost benefit of 50%. So what can ABC Coding Solutions do for you? First of all, you have to decide if you want to remain a cash practice or if you want to explore insurance reimbursement. Some people are perfectly happy only taking cash and they don't want a hassle of dealing with insurance companies, but their patients are demanding it. So a lot of practitioners are wavering on the fact that they may want to file claims for patients just because they want to keep their patients happy. So in that mix, you have to determine as a practitioner, what are your financial goals? How much money do you want to make? How are you doing right now? And do you need to see more patients? And if you want to see more patients, what are the risks if you start filing claims to insurance companies? And what are the rewards? One of the things that we do for practitioners is focus on an ideal number of hours per week worked. We don't want burnout. We want practitioners to have fun or at least enjoy the job they do. And so when we're talking to practitioners, that's part of our discussion, as we also determine what's it costing you to see a patient every year, average, and what's your profit on that patient visit after you calculate all your costs. Now, how many hours are you spending and how many hours will you have to increase working with patients if you're going to meet your revenue goals? referrals. So all of these things are in the mix of creating an ideal practice and work schedule. And we help you determine how many more patients you might need to see per month and how to get those patients. Because we're looking at your net revenue goal and we're understanding if you're there or if you need more patients to be there. And if you do need more patients to reach this goal, what are your options? You can either just file claims and keep the patients you've got happy and then get new patients by advertising, or you can get referrals from insurance companies. So we need to know what you want to do and how much you're spending to get a new patient. So if you decide that you want referrals from insurance companies, then joining a PPO network is the ticket to get those referrals. You're going to have to reduce the money that you charge a little bit, but you're going to see more patients. So you now have to look at the equation. Is it worth it? So one of the things that we're going to do for your practice is look at how many more patients you could be seeing and where those patients are coming from and how you can manage that as you grow your practice. There's some pros and cons of filing insurance company claims. If you work with an insurance company, you have to file insurance claims, and that's a hassle. Quite frankly, it's gotten really complicated. So you might need to hire a professional medical biller to help you do that process. And there's a lot of rules that are implicit in filing insurance claims. But what I'm finding is there's rules no matter what you do. So you might as well follow them and get paid. The positives are you're going to attract more patients. You're going to keep the patients you have happier. And the whole industry is starting to open up for alternatives to conventional medicine. That's happening because there's just not enough doctors. So insurance companies are looking how to have more practitioners on their list of providers to serve the patients that they have, the policyholders they have. Joining an insurance network these days could quickly get your practice to the level that you want it to be. And you can close it down after you have enough patients, so you don't have to keep working as hard in the long run. Why do insurance companies want claims, and why does this promote effective care options? The claim gets filed, well, then what happens to the claim to make the insurance company want to keep paying for services? Well, claims tie treatments to the healthcare problem, which equals a diagnostic code. So insurers look at data every year by diagnostic code, and they see what they're paying per average for that diagnostic code per year. Just like we're looking at your practice, the insurance companies look at theirs. So then they start finding options to that average that are lower than their average cost. And now cost-effective care becomes visible from this data. Data shows holistic care is effective in treating many chronic conditions, especially chronic conditions. So if there's low back pain that's never resolved conventionally except with drugs and surgery, but you have a specific treatment protocol that will get them off of claim in 10 visits or more, you may be cheaper in the long run per year than all they're spending on the drugs and the possible surgeries. So we have to look at the entire treatment protocol over a year in order to compare costs. ABC codes support claims and payments because they precisely communicate what was done to the patient to the insurance company, and it justifies the cost of the service. It also reduces denials once the adjudicator at the insurance company starts looking at the claim. It simplifies your paperwork, and it certainly simplifies the paperwork for the insurance company, and saves both parties time and money. So it's a win for both sides of the equation. So what does an ABC code do to benefit an insurance company? First of all, we make sure that you're only filing codes for things that you have the rights to file codes for services. In other words, are the services you're billing legal? If we can say yes to the insurance company, we've reduced a lot of their anxiety off the bat. That reduces their risks. And we also make sure that your claims fit right into the slot in their systems, and that saves them time and money. Then we help them extract data from the claims to show them cost-effective options to services they're paying too much money for. So what's an ABC code? Well, this Information right here fits into an 80-character field inside an electronic claim used to supplement medical codes. So ABC codes fit into everybody's system. The longer description is published in the coding manual to precisely describe what was done to the patient, for what reason, and it also says, does this practitioner need more training above their core competency? In other words, are they trained to do this as part of their license, or do they need additional training in order to do the service? Then we help the practitioner show the insurance company the training that they have. So all of this is done to supplement the ABC code and build the precision in the filing system to reduce paperwork and cost. And all of this information helps the insurance company as much as it helps the provider, because it's a better way to talk to each other. So how do we help practitioners reach their goals? Well, we guide them in setting their practices up to legally bill for what they do. And we go into their NPI number to make sure that they've told the insurance companies everything they're trained to do. So we assist them in identifying and reaching their goals by allowing them to bill for more services, because they are showing the insurance company they're trained to provide more services. That maximizes their reimbursement and reduces the liability and cost on the insurance company's side. So you're going to attract and retain patients if you work with insurance companies. And if you go the full route of working as a PPO network provider, you can attract referrals. So recapping, why should you pay attention to this presentation? If you want to attract and retain your patients, you should listen to this webinar. If you want to reduce the risk that insurance companies have by dealing with practitioners, listen to this presentation. If you want to save time and money documenting what you do and have the insurance company save time and money understanding what you do, listen to this presentation. If you want to gain control of your income and your time, listen to this presentation. I've had a good time talking to you today, and I hope we'll hear from you. Here's how you can contact us. Our website is listed here. It's abccodes.com. info@abccodes.com allows you to ask questions via email, and you want to work with me specifically. I don't charge for the first 15 minutes of care, but you have to make an appointment by emailing me, Melina Giannini at abccodes.com. I look forward to hearing from you.